Hello, fellow hospitalists, and welcome to Documentation Talks with Dr. Tom. As always, our objective is to help you get credit for the great work you are already doing and to help you avoid queries. In other words, we want to help you document like a genius. Today's topic is anemia. As hospitalists, we often take care of patients who have anemia as a complication or comorbidity. Because of this, it is important for us to know how to document anemia correctly so that we get credit for how severely ill our patients really are. The correct documentation of anemia is really quite simple and requires only two elements. The first is acuity, and that can be acute, chronic, or acute on chronic. The second is we must tie the anemia to an etiology, such as upper gastrointestinal bleeding or end-stage kidney disease. Now, for a few tips when you're documenting anemia. First of all, it is important to keep in mind that terms such as macrocytic anemia or iron deficiency anemia are categories of anemia and not etiologies. Along these lines, when we're forming a differential diagnosis and come up with a likely diagnosis, it is important for us to document using the terms possible, probable, or suspected. And then, when the final diagnosis becomes apparent, update the documentation with the final diagnosis and carry it through to the discharge summary. Another important tip is that the coders will not recognize terms such as low hemoglobin or low hematocrit. And if you use these terms, it will likely result in a query. Lastly, it's important for us to document our treatment plan, but transfusion does not have to be part of the treatment plan in order to make the diagnosis of anemia. Now, for some examples of complete and accurate documentation of anemia. The first would be acute blood loss anemia from suspected upper gastrointestinal bleeding. Another would be chronic anemia from end-stage kidney disease. In summary, complete and accurate documentation of anemia only requires two elements, acuity and etiology. And remember the important tips, including documenting a likely diagnosis as possible, probable, or suspected, and then updating it with the final diagnosis and carrying it through to the discharge summary. Thank you for listening, hospitalists. Please stay tuned. Next month, we're going to be covering another important topic, renal failure.